Hello, welcome into All Things Odd. I'm Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
All right, and so we've got a really cool topic for you today. But before we get there, I'm going to have Dr. Galloway talk real quickly about our YouTube channel here.
Yep, so if you go to our YouTube channel, you can search our business name and subscribe. We're always looking for new subscribers, and then you can see the content in kind of a different manner there. It's easier to see the thumbnails and kind of what the shows were about, and there's playlists, so you can send them on to somebody that doesn't have Facebook.
Yeah. All right. And then we got it shared into some of our audiology groups here too. So we want to make sure that people kind of join in the conversation as well. So today, what we thought we'd kind of talk about is something that we've kind of seen happen and just kind of get people confused a little bit about what an audiologist is. And so we definitely wanted to kind of touch base on what an audiologist is. So we're going to kick it off just by looking at some of the, the letters, the degrees, whatever's behind a name. I know that some audiologists use some different things. And so we wanted to talk about what an audiologist is and the credentials behind it, but then also some of the other ones that get confused with what an audiologist is. So we're going to start off with this. And some of the terms, we're going to read it off because we've actually pulled up a document from the American Academy of Audiology on definitions of some of these different professions. So whether it's an audiologist, an ENT, or otolaryngologist, hearing instrument specialist, we're going to kind of go over all of those. And then what are some of the other letters behind there? And then also, what are some other terms that we've heard about that people are using, and to just kind of clear everything up and let you guys know exactly what certain things are. So as an audiologist, you can have multiple degrees. You can have a master's degree, a doctorate degree, which is the Au.D that you see, a clinical doctorate, and then also a Ph.D, which is more of the research and the teaching type of doctorate as well. So from AAA, or the American Academy of Audiology, what their definition of an audiologist is: the primary healthcare professional who evaluates, diagnoses, treats, and manages hearing loss and balance disorders in individuals of all ages, from infants and teens to adults and the elderly. So audiologists are trained to understand and program hearing aids, cochlear implants, assistive listening devices, bone-anchored hearing aids, and a lot more. And they're the only qualified professionals who can diagnose an individual with auditory processing disorder, or what people call like a hidden hearing loss. Like you notice it more when you are in background sounds, things like that. And so different settings that audiologists work in would be hospitals, clinics, private practices, even with an ear, nose, and throat physician, universities, school audiology, government, military, and VAs, or Veteran Administration hospitals. And so audiologists, like you kind of see all the different letters down there, might have maybe a Doctor of Audiology degree, which is the Au.D. Some of them have the Ph.D, the Doctor of Philosophy. Some even have a Doctor of Science. And so we didn't put that up there, but it's an SCD, which is the Doctor of Science in Hearing and Balance Sciences. And then they have to be licensed and they have to be registered to practice in the state that they are living in, right? In addition to District of Columbia and Puerto Rico. And so besides that, there are some other board certifications or certifications that audiologists can then get for tinnitus, or for working just with pediatrics, or even cochlear implants. And we do have a body or an organization, I should say, the American Board of Audiology, that provides board certification in some other specialties like tinnitus, cochlear implants, pediatrics. So that's what an audiologist does. Okay. So we're going to kind of kick that off with just what that is. Schooling wise, anywhere from about, I would say like 6-ish to 8 years, depending on when you went through school. But there is that undergraduate degree plus the master's or / doctorate, which then takes you into at least 2 to 4 years, clinical fellowship years, rotations, things like that. And you see some of ours, you'll see as we take students, there are audiology students that come through on their third year type of externship, as well as fourth year. So that's an audiologist. So I'm going to have Dr. Galloway talk about what an ENT, otolaryngologist, otologist, neurotologist is all about.
Yes. So there's a lot of different specialties here. People a lot of times have heard of an ENT doctor, because somebody got their tonsils out or whatever. So ENT is a more common name, but ENT is actually just an acronym for otolaryngologist. Oto is the ear part, larynx, and then ologist. So neuro-otologist or just an otologist. Otologist is just an ear specialist, whereas a neuro-otologist is an ear-brain specialist. So actually our medical referral source in Fort Collins is an otologist. So, if we have a patient come in and they want a second opinion on their hearing loss, or they have kind of a medically involved hearing loss, we refer to our otologist. Neuro-otology, we refer to a clinic in Denver, and that's where we send our cochlear implant patients. So the neuro-otologists that we work with do the cochlear implant surgery. So all of these professionals that I've listed are medical doctors. So they went to medical school, and the specialty is just the area that they've chosen, just ears, nose, throat, or ear, brain. But they're all medical doctors. So you can call them all doctor, and they all went to medical school. They just have slightly different specialties.
Yeah, and I used to work at UC Irvine Medical Center in California, and to me that made the most sense with categorizing all what is an otolaryngologist, right? And so there were attendings and there were residents. There was like probably eight attendings, 8 to 10 residents, and basically they all go in their medical school and training. And so obviously they've got their undergraduate, then they have their post-bachelor's degree. Medical school is followed by a 5-year residency for some people. Typically like 4, but sometimes if they want to go on for specialties. And so everybody kind of went into general ENT, so ear, nose, and throat. And then they broke off. And so you would go in and you could just be general ENT, and you can still just be a general ENT. Or if you wanted a specialty. So I had a lot of residents that went on an extra year for just otology and head and neck basic surgery. Or they went into cancer research, right, with the throat. Or they did just pediatrics, right? Or so there's also like the or after medical school if you want to specialize even further. And so then after UC Irvine Medical Center, then I broke off with an otologist, neurotologist actually, who did that extra fellowship year to get more of just the ear-related surgeries, head and neck and skull-based surgery, as well as like could do the cochlear implants, acoustic neuromas or acoustic tumors, things like that. And so that would be a specialty off of just general ENT. And so that would be your MDs. They actually went through medical school. And so those are some of the terms that you see, right, that we have posted here. So ENT, ear, nose, and throat physician, otolaryngology, otologist, neurotologist is kind of a little bit more into the specialty of just the ears and the ear and the brain, like Dr. Galloway had said too. Yeah. All right. And that would be the people who do the surgical components, right? Of some of the things that we refer to. Okay. So then we're going to talk about what is a hearing instrument specialist, or an HIS, or BCHIS. BC stands for the Board Certified Hearing Instrument Specialist. And so for these, according to the International Hearing Society, a hearing instrument specialist is state licensed, and they're a health professional trained to evaluate common types of hearing loss and to fit hearing aids, and to fit hearing aids only. So basically, it's do hearing tests to be able to fit hearing aids. And they're typically licensed to perform these hearing aid fittings, maybe even do ear mold impressions, but they do not diagnose hearing loss or hearing disorders, and are not trained to diagnose or treat tinnitus, hyperacusis, auditory processing disorders, and other auditory cognitive processing skills. That would be more of an audiologist, like we had talked about earlier. For them, as far as their degree, they can just have a high school degree, and then they can go and train and pass a state examination to dispense hearing aids only. Sometimes they go and get an associate's degree, and then they go and get their state license. And so hearing instrument specialists, if you see HIS or BCHIS, that means that they are licensed to perform hearing tests and then fit hearing aids, basically. I'm trying to think if there's anything else.
Nope, that's it. And actually, I've seen, especially in the state of Colorado, I've seen people that have a bachelor's degree in, like, my bachelor's degree is in speech language hearing. Some people it's communication sciences and disorders. But I've seen on different bios where people will say, they got a bachelor's degree in communication disorders or something like that. And it's a little bit misleading because it seems like they, got more than a bachelor's degree when really they have a bachelor's degree and then also are a hearing instrument specialist. So sometimes the bio will say something like they graduated from, wherever with this bachelor's degree in communication sciences, but I've seen it where it's a little bit confusing. So you can have a bachelor's degree in whatever and then become a hearing instrument specialist. And obviously people that have a bachelor's degree in communication sciences are going to be better versed, than somebody that had not a bachelor's degree.
Like in theater.
or just had a high school diploma, but it doesn't mean that they went through the graduate level education.
Yeah. And they could still be passionate about like the ears, right? And be able to help people to communicate better, which would be, still a hearing instrument specialist, right? So, okay. So we've talked about, if you're just joining in, because I see some other people, we've talked about the degrees and the letters and everything behind both an audiologist. Okay. So you'll see MS, AUD, PhD sometimes behind an ear, nose, and throat physician, where you're going to see an MD behind an otolaryngologist, otologist, neurotologist.
Or DO. I guess we should have added that. So they could be a doctor of osteopathic medicine in any of those specialties.
And then also the HIS, or if you see the BCHIS, what that stands for. Okay, so then we're going to head back to audiology for a little bit here and talk about, okay, what is this CCC-A that we see then sometimes behind people's names? And so again, depending on what you see, this is the Certificate of Clinical Competence, which when I was going through school, so I'll talk about my experience and I'll have Dr. Galloway talk about hers. When I was going through school, it was kind of like the only thing that said, after you graduate, besides your MS, like you have to kind of get like a CCC-A, which is the Certificate of Clinical Competence, which means that I had to do a clinical fellowship year through this governing body called the American Speech and Hearing Association, okay, ASHA. And then I had to do a praxis exam and then make sure that I passed that to get this CCC-A, or the Certificate of Clinical Competence in Audiology. That's what the A stands for. Since then, I've dropped my C's because I don't feel like I necessarily need them. And also we have another governing body, which is the American Academy of Audiology, which really represents what I feel audiology a lot better. I did have to get it back just to be able to supervise, which is a little crazy. Again, this is all of our opinions. And so, as you're listening to this, just know that it's our opinions. But it was a little crazy because I had to get it back. I had to take the praxis exam again in order to supervise students. So Hannah was actually my student. So in order for her to be able to graduate, she had to be supervised by an audiologist who still had their C's. And a lot of audiologists and our colleagues have dropped theirs, what they call C's. But if you see this behind them, most of the times it's because people are keeping them for either they do believe still that ASHA is a great governing body, or they also want to supervise students who actually need to be supervised by a CCC-A. Some students, they don't need to, right? And some programs, they don't need to. And so Hannah, I'm going to talk about her C's and what she has agreed to do as well.
So, and it actually has to do with how the university that you graduate from's accrediting body and who's accrediting the program. So many programs have a speech program as well. And so that kind of plays in, but it is a little bit antiquated to require the C's. And so actually I've kind of tried to make it my personal crusade to, yes, I'm still carrying them and we're still paying for them, but to push back on the sites that are saying, do you hold your C's? Yes, I do, but why do I need them? Because it doesn't mean that I did anything other than just pay them more money, which is kind of silly. So when I went through school, I got my doctorate. So I went straight from bachelor's to doctorate degree. And then whenever I graduated, I had the opportunity to get my C's because I had been supervised by somebody who had their C's. And our local University of Northern Colorado, that's where I graduated from, they are still wanting people to have their C's. So I still have them, and we can take those students or students from another, university that's requiring it. But I'm trying to make it kind of my personal crusade to push back on it, because you'll see in all these professional boards, people say, well, I take students and I don't have to have my C's, and we made it work. So the universities need to have a little bit of pressure put on them to realize that that's not what it used to be. And now, I have FAAA, so Fellowship of the American Academy of Audiology, which is that other governing body. And then also the CCC-A, the Certificate of Clinical Competence in Audiology. But we have to take the praxis to be an audiologist and get your license. So really the C's are just paying extra money every year. But, we are still doing it in the hopes of, furthering the cause. And hopefully we can drop those at some point. But I do carry those, and that's what it is. It's more that I'm the contact in our office of supervising students and, the university, working with the university programs.
Yeah. And so which comes to what is the FAAA, which is what Dr. Galloway had talked about earlier as well, too, which is the Fellow of the American Academy of Audiology. That's what the FAAA is. And so, again, this is something that some people display, some people don't, because basically you pay our fee of our, what is it called? The association, I guess, fee. And then we are basically a fellow of the American Academy of Audiology. And so if you see that, then that also just says that they are part of the American Academy of Audiology as well. Okay. So again, I know that there's a lot of letters here, but we're trying to clarify it for people because there's so many letters and so many people to do some different things. So that's all related to audiology. Okay. So now what we thought we would kind of head over to is this question here. And this was kind of interesting. So as people are tuning in, so we've actually seen that this question kind of comes up here too. And it's, what is an audio prosthologist? And so we thought we'd kind of touch upon this as well, because I think it's kind of interesting about what an audio prosthologist is. So with this one, really, an audio prosthologist is basically what we had talked about earlier, a hearing instrument specialist, right? It is somebody that can work with hearing aids and can dispense hearing aids. I'm going to pull this thing up that we found because I thought it was kind of interesting. And this is basically, it looks like it was a maybe a legal document or a resolution of something where there was a question of, what is an audio prosthologist and, can we still use this term? So this was put out, it looks like, from the American Academy of Audiology. And I don't know if you guys can actually read this or not, but we're going to kind of go over some of these different things here. Okay, so as Dr. Galloway is going to run and check on something real quick. So I'm going to pull this up, and basically what it says is, as an audio prosthologist, it looks like this was a resolution back in 2008 for the state of Oregon. And it's funny because we brought this up because it says individuals who are not licensed audiologists are misrepresenting their qualifications to consumers when they use titles such as audio prosthologist. And it implies the practice of audiology. And it had been determined that this use of audio prostology was a term that was made up, and there was a specific goal in confusing the consumer with its similarity to the word audiology. And so again, this was used, and it has been prohibited in several states, including Oregon and Ohio. Not in all states, though. So as we talked about the degrees, right, of audiologists, this document also shows that audiologists have master's degrees, doctorate degrees, and then at the end, I think it's kind of funny because there was a ruling to stop using the term audio prosthologist, and there's also a deceptive acts and practices law that basically said cease and desist on using this. So again, we had found this article that things have been resolved and that it was, basically told not to use the term audio prosthologist. But if you still do see it, because maybe there are people that have used the term audio prosthologist before, maybe it hasn't been banned in that state, but basically we want you to know that the term audio prosthologist basically means a hearing aid dispenser or a hearing instrument specialist, I should say. Yeah. Okay. So hopefully that cleared that up. Okay. On to the next one. Okay, so then we see terms such as neuroscientist, neurologist, neurotologist. Okay, so we're going to work backwards on this one. So we had already talked about what a neurotologist is, right? Or an otologist, basically general ENT that have gone through another fellowship year to then become an otologist or a neurotologist, right? Neurologist as well too. We wanted to just kind of touch upon that. Basically, a neurologist is an MD, right? And they have an undergraduate degree. They went through 4 years of medical school, and then they did a year of an internship to be a neurologist. But as you can see, the difference in spelling between neurotologist and neurologist, there's no odo in there, which is the ear related, right? So neurologist, as you can guess, is going to be more related to the brain, right? And so you're looking at an MD. Those last two terms are an MD as a neurologist, or a neurotologist is also an MD, but it's brain and ear, right? Okay, which brings us to neuroscientist. And so we did some digging on what a neuroscientist is. And I'm going to have Dr. Galloway talk about this here.
Yep. So a neuroscientist is not a medical doctor, but can be just a scientist that has a degree so they can have a doctorate degree, like a PhD in neuroscience. Neuroscientists focus on the brain and its impact on behavior and cognitive function. So not only is neuroscience concerned with the normal function of the nervous system, but also what happens to the nervous system when people have neurological, psychiatric, and neurodevelopmental disorders. And so you can also see how a neuroscientist and a neurologist could possibly get confused. But a neurologist or a neurotologist went to medical school, has that MD or DO, and a neuroscientist is somebody who's a general scientist that may have a doctorate degree in neuroscience or a master's degree or something like that.
Yeah. And we're not saying that neuroscientists aren't MDs. Like you could still be a neuroscientist, right? And still have a degree in medicine or have that MD if they went on to that MD, the classes, their clinical rotations at a teaching hospital. But you can expect that neuroscientists that might also have their MD to probably use MD in it, right? If they actually went to medical school. So you can still be a neuroscientist and have your MD. And have that 8-year kind of joint program of having maybe that PhD in neuroscience and then also the MD. But you do have to pass, if you are an MD and you're a neuroscientist, then you have to still pass your physician licensing exams and complete a residency. So hopefully that clears up. Neuroscientists are mostly PhD. They did their studies in neuroscience and that doctorate. But you can still have a neuroscientist that might be an MD as well, if they've actually gone through medical school for that. So hopefully that clears that up. Okay, so all this mumbo jumbo, okay, we just wanted to make sure it was clear. Okay, just we have some great when in doubt or ideas, so that you know who you're seeing, because it's still really confusing. You'd be like, oh my God, like I'm just, all these letters are swimming around in my head above me or whatever, still so confused. So go back and watch this, share this out. But when in doubt, we have some ideas for you to check out. So I'll have Dr. Galloway talk about that.
Yep. So you can always check the Better Business Bureau. That's kind of a way of checking. The other thing that you can do is just get on, the website or whatever, and just look at the bios of the professionals. If I'm going to go see a professional that I don't know a lot about the field, I will just Google and try to figure out, what is the degree that a neurologist has or whatever. And so that way I'm a little bit better versed when I'm looking through websites of who might be the right provider for me. So you can contact your state to validate whether the license is current. And you can also, I know for us, you can look up our license numbers to see if anybody has filed an infraction against you or anything like that. If you've had any, medical malpractice, anything. So you can search that. And then you can also ask family and friends for referrals. You can check Google reviews or just reviews. They say if you're happy, you tell one person, and if you're mad, you tell 10 people. And so sometimes when you're looking at the reviews for a business, you may be able to get a little bit more information about that provider and, how people are leaving their office feeling about their care. So we have a lot more resources now than ever before and kind of ways to check it out.
Yeah. So again, you guys, thank you for tuning in. Again, if you're just joining in or catching the replay, we are trying to clarify some of the different credentials that are behind audiologists or associated professions. And if you missed it, I just kind of want to go through some of the things that we talked about. We've talked about what an audiologist degree is, and the letters that you see behind an audiologist, the difference between an ear, nose, and throat physician, otolaryngologist, otologist, neurotologist, which is a physician, MD. We talked about also the letters that you see behind an audiologist degree, like maybe CCC-A, what that means, maybe what the FAAA means for people that are listing that. We talked about what an audioprosthologist is as well. So hopefully by watching this,
isn't,
yes. So hopefully by watching this, you know what an audioprosthologist is if you see that term. And in certain states, again, it is banned to use that because of deceptive practices. And then also we talked about what a neuroscientist is, neurologist, neurotologist, right, is, because I think that those terms kind of like, again, combine and get people confused. So with that, hopefully you guys learned something today. And if you have any questions, reach out to us so that we can help you clarify that, or pass this on to somebody who might have that confusion as well, so we can get everybody on the same page. And with that, we are going to end our show, and we will see you next week.